This is Dr. Kamel again, and the new content related to the physical therapy license exam preparation. So, if you didn't see any of my videos before, my name is Dr. Kamel. I work as Associate Professor of Physical Therapy in the United States, and I am a licensed physical therapist in a number of states across the US, also in the UK and in Egypt. I have got my PhD from University of Nottingham in the UK. So let's go for today's content. The patient is referred to physical therapy for participation in a cardiac rehabilitation program following a recent cardiac event. This cardiac event, could be, angina, myocardial infarction, unstable angina, myocardial infarction, or open heart surgery, coronary artery bypass graft, we don't know yet. During the initial evaluation, which of the following actions should the physical therapist perform first? A. Instruct the patient to describe the correct techniques for therapeutic exercise. B. Ask the patient to list complications associated with poor nutritional habits. C. Have the patient explain the harmful effects of smoking on cardiac health. D. Ask the patient to describe the characteristics of their angina symptoms. And which one you think is more critical? And we can start first to ask about. So the answer is D. Okay, this patient just had a recent cardiac event, and we need to understand more about what happened. So D, ask the patient to describe the characteristics of their angina symptoms. Very important. I need to understand what happened, how it happened, and this is the first time or what happened. So the key word in this question is the word first. Okay, we would like to ask about all this information, but which one is our priority to start first? So the signal, is priority decision making. Which one should be first? Okay, so in cardiac rehabilitation, we need to start with assessment of the current cardiovascular status and the symptom stability. If the patient is stable enough, hemodynamically stable, and then we can start our cardiac rehabilitation exercise, physical therapy intervention, or whatever, or the patient is not stable actually, and we should not proceed. So understanding the patient's angina is critical. Why? Because number one, safety for exercise participation. If the patient still have anginal symptoms, I would not start. I would not issue exercise program. Appropriate intensity levels. Usually we have what's called angina threshold when we would stop and stuff like that. Whether medical referral is needed if the patient is complaining about sudden chest pain or something. Sometimes the patient having infarction and few days later having another infarction or reinfarction. So we need to understand. What else? So types of angina, we have several types of angina, as you know. And stable angina, unstable angina, presenzimittal angina. What type of angina the patient have? In a stable angina, we have a predictable course. This chest pain is increasing usually with exertion and is usually reduced with rest. Taking nitroglycerin will be relieved. Okay, so exercise is generally safe with monitoring. And what I mean by monitoring of vital signs, monitoring of telemetry, which is the ECG, if it is available. How about unstable angina? It can occur at rest and it is unpredictable. So this is dangerous. Not consistently relieved by rest. If I'm asking the patient to rest, might not go away. So this is contraindication actually to exercise, and it will require immediate medical attention. Refer the patient to ER or whatever. So identifying type of angina is very important. I need to understand and ask the patient to describe the characteristics of their anginal symptom. in order to have the proper clinical decision making and for patient safety. Okay, so this is the answer. Let's look at the incorrect options. A. Exercise technique instructions. Okay, this is like intervention or education, not initial assessment. And we are now doing initial assessment for a patient starting cardiac rehab. So I cannot safely proceed with any intervention without knowing if the patient is stable, cardiac stable or not. B. Nutritional habit problems. Yeah, this is important for risk factor modification. Like if the patient need to be on a low salt diet, like patient with hypertension, patient with hyperlipids, reducing fat amount and fat content of food, but it is not urgent. Okay, so this is like not immediate exercise safety. Effects of smoking. Again, this is a patient education or prevention based long term thing, not the initial clinical decision making. Okay. So when I am answering any question, I need to understand what is the hierarchy, what is the order. Number one, always safety, red flags, like for example, in this question, unstable angina. Number two, assessment. Number three, intervention. Number four, education. This is the usual sequence which I am doing with any patient. Okay. So if the patient having a cardiac patient, unstable angina, I should stop and refer immediately. No exercise should be initiated. Okay, and so in order to summarize, so in order to intervene with this patient who just starting cardiac rehabilitation after cardiac dysfunction, I need to do full examination of this patient, full evaluation, in order to properly do a treatment plan. Okay, so one of the important aspect of examination is making sure that this angina is stable, not unstable angina, and I need to prevent further experience or exacerbation of anginal symptom with exercise or during my treatment sessions. So this is the most important one to ask about. If you would like to join my BT license exam preparation course, please send me a message, WhatsApp message on 001442248726 or 00201027743702. If you would like to also apply and join the post-professional DBT program at University of Montana in the US, which is online program at a discounted rate, we can also help you to be admitted to this program. Send me a message on either numbers of WhatsApp number, and I will send you the required documents, transcripts, everything, so you can join easily. Thank you for watching me. I would appreciate if you can subscribe to the channel so you can every new content or every new video you would receive a notification, and at the same time if you can kindly share my channel with your colleagues, either graduates or students, will be much appreciated. Thank you so much and see you soon in a new content.